Thank you for joining us here. I should start with, you actually prefer Nirav Shah as opposed to Dr. Shah, right?
That's exactly right, Kevin. Yes, please.
So I think most Mainers are probably familiar with you, certainly your voice, your face, from your leadership of the Maine CDC during the pandemic. You stepped down from the Maine CDC after about 4 years in that role in order to lead the US CDC. And I remember at the time when you announced your resignation, you said that you and your wife were going to be keeping your house in Brunswick and that your plan was to come back to Maine after the US CDC role ended. And so now here you are, and here you are. You're not only back in Maine, but you're hoping to lead the state. So I guess let's start there. When you came back, I think it was early 2025, right, to Maine, was that on your mind? Were you thinking, I'm going to run for governor, or I'm going to run for Senate, or I'm going to run for Brunswick Town Council, or what was it that prompted you to get into the race?
Thanks, Kevin. First, and I really appreciate the opportunity to have this conversation. You're right, we moved back to Maine after my service in the federal government. That was always the plan. I was never keen on leaving Maine in the first instance, and so I took the job with the federal government with the stipulation that I was not going to be a lifer there, that I would go and help stabilize things because I wanted to get back to Maine as quickly as possible. And when I returned, what I knew for certain is that I wanted to continue in public service. I had worked in the private sector earlier in my career, and I have done that, and I knew that I wanted to stay in public service. Now, what that looked like was somewhat unclear. And several weeks, months after we came back to Maine, I was approached by a couple of different groups of friends to consider running for office. My initial reaction was a little skeptical. I sort of thought, gosh, are we friends? Why would you suggest such a thing in this moment? But the more I thought about where we were in this country and seeing the destruction that was happening as a result of RFK and Donald Trump to not just health institutions, but a number of other, the EPA, education, FEMA, I came to the view that I could not just stand on the sidelines while that was happening, and that frankly, all of us should be thinking about running for something right now. In my case, what I concluded was the way in which I could both continue in public service and do the most possible to help Mainers right now was to ultimately run for governor.
So we have a pretty robust field in the Democratic primary, as you know. There's a former House Speaker who's a top advisor to the current governor, former Senate President, current Secretary of State. We have a businessman whose father was governor and is now U.S. Senator. Your background is in public health. I guess what's your argument to Maine primary voters about why they should choose you over some of these other folks who have decades of experience in Augusta?
Well, you're exactly right. We do have a robust field, and that's a sign of the health of Maine's democracy, at least on the Democratic side of the ticket. That said, there are a few things that I think set me apart that I think would be compelling for Democratic primary voters. The first is that Mainers know me. They have seen me in action, they have seen me show up, and they have seen me make tough decisions, hold people accountable, and then communicate about them in real time. In that regard, Mainers have seen what I do, and they have seen what we can accomplish together. Some of the highest vaccination rates in the country, some of the lowest age-adjusted death rates in the country, and we did that together. And so in that sense, Mainers have seen how I go about doing jobs of leadership. But there are a couple of other things that I think are important. I'm also the one candidate who has had deep experience doing something akin to what the governor does, which is running really large organizations. The US CDC, for example, is roughly the same size in terms of the number of people as the state of Maine government, or at least it was when I was there. It also has a much bigger budget than the state of Maine, and I would say at least equal complexity given the number of things the CDC does. And as you noted, I was one of the leaders of that organization for 2 years.
You were second in charge.
I was second in command at the US CDC, which meant my portfolio entailed everything that was going on at that agency, whether it was working with Congress, whether it was dealing with outbreaks or national security situations, everything that happened there. And I've had experience managing and leading, especially in times of crisis. The third thing that I think is critical is I am the only attorney that is running on the Democratic field. Right off the bat, being an attorney enables you to be fluent in a lot of different policy areas, as well as have comfort with things like regulation. And in this moment of the Trump administration, what I think is important is that the way in which the Trump administration, one of the ways in which they have been routinely beaten back or held in abeyance has been through the court system, been through the judicial branch. And as we've seen with Governor Mills and prior governors in other states as well, fluency with the court system, knowing how to use it as a sword and a shield to protect Mainers is going to be critical.
Looking at a few of the issues, I know, not surprisingly, you've made healthcare and public health top priorities of your campaign. I want to ask specifically about some of your plans for helping older Mainers.
Yeah.
You've talked about launching a caregiver corps. You've talked about heavy investment to help keep older Mainers in their homes, even if they have disabilities and dementia, and you want the state to play a more active role in supporting nursing homes to prevent them from going out of business. Those are all ambitious but costly initiatives. I guess, what's your plan for paying for things like that?
Fantastic, Kevin. You're absolutely right. I mean, as one expert I spoke with here in Maine pointed out, older Mainers are our future in a number of different ways. And so that plan is organized around that North Star. The first thing I think about, Kevin, is what are the consequences of not making these investments, of not making this additional investment in making sure Mainers can age in place and have the services they need. The truth of the matter is if we don't do these things, we will see even higher costs down the road through things like more falls, suicides, untimely deaths, starvation, hunger among older Mainers. So we are already grappling with these costs. The question is whether we choose to address them and avert suffering or choose to ignore them and entail suffering. That said, we still have to pay those bills today. So one of the ways in which one of the avenues of additional funding that I've supported is a millionaire's tax. I recognize that is moving through the process right now. That will generate $70 to $90 million in additional revenue. The price tag on much of the work for older Mainers starts with about $9 to $10 million in support of what's called the Older Mainers Act, and then additional funding in the form of scholarships for those who wish to go into care, whether it's as a medical assistant or a nurse. That additional revenue from the millionaire's tax can help offset some of these additional costs. Ultimately, the way in which our overall state budget will need to grow is not necessarily through new taxes, but through more growth, through more people coming to Maine, through more small businesses setting up shop here, generating not just jobs, but also additional tax revenue.
Affordable housing has been a top concern, top issue for everybody in the campaign. I guess how would Nirav Shah's plan for addressing affordable housing differ from the other Democratic contenders?
I start my thinking around affordable housing with doing everything we can to increase the supply. To me, that is where the real roadblock or the real bottleneck in our system is. There's simply not enough housing of all stripes. Small starter homes, condos in high density areas, you name it, we need more of it. So my emphasis will be on making it easier to build, and then once built, making it easier for folks to get in to those homes. The easier to build starts with things like additional modifications to zoning. Having the state sponsor infrastructure bonds so that we can actually get water and sewage to the right places so we can build not just single family homes, but high density homes. Attracting more workers to Maine because the housing crisis from a workforce perspective is an economic opportunity. So more folks wanting to come here to participate in the building trades. Doing all of those things in tandem is how other states have made headway into their housing crises. Maine can and should do the same. Now, I want to be clear, Kevin, doing this does not entail wrecking our environment or paving over our parks or anything of that nature. There is an opportunity here in Maine to show the world how we can build additional housing and still be environmentally responsible in doing so. We can, for example, prioritize density, as has already started happening in some places in the state in southern Maine. We have also a number of opportunities for so-called infill development. using buildings that are already in place and converting them or rehabbing them so they can be made into housing. That's already happened in places like Biddeford. There are plans to do so in Bangor. There are ways we can prioritize that without necessarily hamstringing our environment.
And I want to come back. We talked a little bit about your time leading the Maine CDC. I've certainly heard from your campaign that they point to polls suggesting that you do have higher levels of trust among some Mainers because of your role during that time, which is a traumatic and stressful time for many people. But as you know, there's a segment of the population here that disagrees, that thinks the state overreacted, and thinks that our restrictions caused long-standing damage to businesses, to student learning. If you win the Democratic nomination, how are you going to convince folks like that to vote for you in November?
Great. Well, first, you're right, Kevin. What Mainers say to me when they come up to me and chat is that they trust me, and that's what they reflect back to me. Whether they agree with me on different policies, sometimes or not. What they ultimately say is that they trust me to evaluate the situation, make a tough decision, and then communicate about it. Of course, that's not uniform. As you noted, there are certainly folks across the state who disagree with many of the decisions that I and others made in Maine and nationally during the pandemic. I welcome that conversation. I think what Mainers have also seen about me is that I do not shy away from tough conversations. I don't shy away from sometimes even contentious conversations. I always treat those conversations with respect and never condescension. And so I welcome the opportunity to have those discussions with voters who disagree with certain actions that we took. I pledge to always have those conversations in the spirit of openness and never in the spirit of condescension or punching down. How do you know that that's how I'll go about it? I've already done so during the pandemic. We dedicated specific blocks of Maine Calling just for skeptics to call in and ask me their toughest questions. And on one of those, one episode specifically around vaccines, someone called in and asked me tough questions about the vaccines, and I answered them calmly without condescension. And at the end of that exchange, that guy on the air in front of all 1.4 million Mainers said, "You know what, Nirav? I think I am going to go get that vaccine." And that's how I'm going to do it.
Republicans are obviously, it seems pretty clear they're probably going to hit you pretty hard if you win the nomination on this issue. Is there a risk to kind of framing your campaign around your service to the state during that time?
I don't think so, Kevin. The campaign is not focused on COVID. My message to my staff is don't look back. We're not going that way. So it's not about COVID per se. It is about public service. It's about showing up. It's about leadership. It's about clear, calm communication. And so those are values that I embrace and that I bring with me to no matter what the situation or crisis is. But with respect to COVID itself, that's not the focus of the campaign. In a sense, COVID was the example of my leadership in action. It wasn't the predicate for the campaign. As you say, there will certainly be folks who want to relitigate much of what we went through. As I just mentioned, I welcome those conversations. I think it will also be important to point out in those conversations that Maine had among the lowest age-adjusted death rates in the entire country. Given our older than average population, we had a moral obligation to save as many lives as possible, and the data show that we did so better than just about every other state.
I think at the beginning when we started talking, you mentioned part of the reason you got into the race was because you saw what's happening at the federal level. As someone who's worked at both the state and the federal level, what role do you think the governor can and should play in challenging things that are coming, whether it's from the Trump administration or the next administration who might be in place, whether it's a Democrat or a Republican? Kind of what role would the governor play in that situation? Kevin,
this is a critical question, and it is one of the organizing principles around which my campaign is built. That is, given what is happening because of Donald Trump and RFK and others, the way in which our health, our safety, and our rights will be protected will be through governors and the state governments that they oversee and operate. To put it differently, right now, governors are the first and perhaps the only line of defense against overreach and attacks by the Trump administration. And that is in part why I am running, whether it's around vaccine policy, environmental policy, education policy, it's going to be governors who step up. So how, to your question, how should we think about when to engage versus not? My principle is that I will work with anybody who has the best interest of Mainers at heart. But I will kowtow or bow down to nobody in that regard. So there will be times when I will work with whatever administration is in power in the White House, but there will absolutely be times when the right thing to do is to say no, that is not reflective of Maine's rights or values, and we will be pushing back publicly through the court system or through whatever channel is best appropriate. Having that balance, balancing the need to work with while simultaneously pushing back, is going to be one of the balancing acts that the next governor will have to master. The other being putting forward an affirmative vision for the state of Maine versus a vision that is entirely based on opposition to the Trump administration. I'm endeavoring to do both having a positive vision combined with one that will protect the state of Maine. What I will say there, Kevin, is this issue of how to push back has been on my mind a lot, and that's why about a month ago, I released a plan that's on our website that is entirely about how I, as governor, will safeguard the state of Maine from Trump administration attacks, whether it's protecting our democracy and our right to vote, safeguarding Maine against the next wave of ICE attacks, healthcare and public health, environment, education. I lay out in detail what our lines will be and what we will do when those lines are crossed.
Nirav Shah, thank you very much.
Thanks, Kevin.